What brings you in here today?
I think I may have a sinus infection and was asked to be seen.
Jack is not your typical patient.
Can you tell me more about that sinus infection?
I have had sinus congestion, post-nasal drip, and a pain in my face for 3 days.
The avatar, or virtual human, was created at the Advanced Computing Center for the Arts and Design on the campus of The Ohio State University. The idea was to make it easier for medical students to learn how to ask the right questions when they meet a patient for the first time. Now, the way most medical students currently practice their interviewing skills is with actors who portray real patients. However, not only are these actors expensive and hard to schedule, but also they don't provide consistent responses to every student. So Dr. Doug Danforth from The Ohio State University's Wexner Medical Center began experimenting with something different.
So we wanted to develop a virtual standardized patient that would allow students to practice their history-taking skills. Our initial efforts utilized relatively low fidelity environment, and we really wanted a more realistic looking virtual patient. We wanted patients that could express more emotions and be more realistic to the students. So that's when we reached out to ACAD and talked with Professor Price to try and develop more high fidelity virtual patients for the program.
Well, when we first saw what Dr. Danforth was doing with his training system that he's had been developing and working with avatars, we saw a great opportunity to develop a virtual human that was much more robust in his visual representation, more approachable for a person to have a conversation with. Kellen Macher is one of our MFA students in the design program who is interested in the affective nature of virtual characters that we see both in the Hollywood movie industry and in computer graphics and computer animation.
When Alan came to me, the goal that we set was to create a character that users could accept. You're not going to find a character that you're looking at on a computer monitor that is completely 100% realistic. No one's going to believe they're talking to a human. What we were trying to get was a character that users could accept, so they could converse with it, interact with it, without being distracted by the fact that it's a digital character.
To get med students to accept the virtual patient, several different layers of emotions were actually built into the virtual character.
There's a great deal of research that specifically states how your face will respond with various emotions, how far your eyebrows will furrow, how far up your cheeks will raise, how wide your lips will get. And I tried to embed that research into the responses of the patients. So when the patients are responding on a scale of anger from 10% anger all the way up to 100% anger, they're basically adjusting those variables a little bit more so that each of the points on their face and in their gestures and their postures are altered just enough so that their behavior is more or less that particular emotion.
Second-year medical student Caroline Wynn enjoys the virtual experience and finds it very useful.
It was a pretty interesting experience. I thought it was fun. It's sort of like a game. You're interacting with this 3D character avatar, and then you're trying to respond to what that avatar says to you. And the virtual patient, he'll actually show emotions based on what he says and his responses to your questions. And he'll also follow you if you move around, his eyes will follow you. So I really like it as a tool for practicing my skills and gaining confidence in those skills, being able to repeat it over and over again.
Besides being able to repeat the training, every student receives consistent responses from the virtual patient, as well as objective standardized feedback on their encounters, something you just can't get when using actors. Medical students can also practice on their laptops, which makes it easy to use at any time.
Now, while I'm not a medical student, I did find that interacting with Jack was rather insightful. Okay, I have a question for you. When I say OH, you say
I-O.
Now that is a smart patient.
Reporting from The Ohio State University, I'm Joe Camoriano.